We're here at East Tennessee Health Center West to ask doctors, patients, and nurses what they think of electronic medical records and whether or not they think it's a privacy issue. So tell me a little bit about the electronic medical records.
Electronic medical records are a good way of having patients complete chart online. There are safety measures in place for confidentiality, of course. The office I work in has been using electronic records for about 6 years. All the charts were downloaded into the electronic system. Positives that we've noted are it's so easy to find lab work, x-ray results. We're able to send medical records so much quicker. One of the biggest, I think, our doctors have access to the records even from a home. If they get a report at night of an abnormal lab or x-ray, they're able to access the patient's file.
Have you noticed any complications with patients and stuff? Like, do they know about this and have they asked questions about it?
We did when we were first starting. I had to kind of explain the delay, and you know, it took us a while to get going with it. But now that the physician is used to doing it, it's easy. Patients don't seem to be bothered by it at all. I have heard other offices, though, patients would say all they did was look at their monitor and they didn't look at the patient, and they just worried about that part is an issue for patients. If the physician and the nurse is just looking in there and not making eye contact or really giving the patient the attention. But nothing as to safety or any of that.
Also, I know that there is, you can see patients' prescriptions on something called eScribe. Can you tell me a little bit about that?
Yes, that is another thing that is going to be a mandatory very soon for all offices, probably linked to hospitals, where prescriptions are all sent electronically to where the pharmacy will get them through the electronic method. What this will help do is cut down on errors. Obviously, doctors' handwriting is a big issue, doses. So that cuts out many questions as to regards to that.
I think it could also serve a problem as people being able to get into the system and seeing what prescriptions that certain people have and finding their addresses.
That is a big issue, and I'm guessing the same types of guidelines are in place to protect the medical prescriptions, just exactly the same as the medical records.
What are your thoughts on the electronic medical records being e-filed?
I think it gives more room for patients to have their medical records exposed and looked at by people that they don't want looking at it. It's definitely a privacy concern, especially with groups like Anonymous that particularly target things like that.
Have you noticed anything change in the way that you're checked in at a hospital?
Not at a hospital. When I went to the doctor, we're using a tablet of some sorts to carry around, which kind of made me nervous just in the sense if it was set down somewhere. But I guess it'd be the same way with a paper file. It could be set down anywhere, but I always think that you can't read doctor's handwriting anyway. But on a computer, I feel like that would be easy to be able to set down somewhere. But I mean, if you have AIDS or HIV, something like that, that's definitely something you don't want people, that's very personal, very private. You don't want people knowing that. If you have any kind of genetic disorders, you don't want that out for people to view. And with it being online, it's in a whole sphere of stuff that legislation has not really been able to keep up with.
Your experience with electronic medical records?
With some you can, with some of the electronic you can file, and some you cannot. The ones you cannot file are the narcotics. As for our patients that take Adderall, anything with Ritalin or any of that, with the amphetamines cannot be e-filed. All of those have to be picked up, hand-delivered to the pharmacy by the patient.
Do you think that many hospitals or doctors' offices will be forced to use eScribe or e-file things from now on?
Right now, probably 8 out of 10 doctors are using eScribe now. Probably the ones that are not using it are the smaller, the more older family practitioners. But most of your larger companies such as HealthStar or any of the groups that are around here, they're all using eScribe.
Now some people think that this is kind of a privacy issue.
It could be a privacy issue, but it's the same as with you as using any internet-based. If you're not using a secure server, then anyone can hack into it. And then even with a secure server, the right people can still hack into it.
E-scripts seem to be the way of the future, making both doctors and nurses' jobs easier. Just like any other internet service, though, there are possibilities of privacy questions. So far, no patient's records have been compromised and no issues have been raised. If you have a question about your doctor records being filed electronically, ask your physician if they have moved to the electronic route yet and what they plan on doing to protect your records.